Aversion therapy is a behavior therapy in which an aversive stimuli is paired with a harmful or socially undesirable behavior until the behavior becomes associated with pain or discomfort. This treatment are for individuals who want to rid of undesirable demeanors, such as bad habits, alcoholics, smokers, or phobias, or unwanted behaviors. An example of this therapy is the ECT, or electroconvulsive therapy, where the therapist brings a series of small electric shocks to the patient until the pain is associated with this patient's desire, in this case, to smoke. After the therapy, when it has successfully associated into the patient's mind, even a sight of a cigarette can trigger their memory that smoking is not a pleasurable stimulus no longer, but as a sign of punishment. Later in life, temptations may still appear in different occasions, but the impact from the aversive therapy can still be as staggering in the patient's mind to solidify their way of rationalizing their decisions. Another case the aversive therapy may be used are for the alcoholics. An alcoholic generally refers to an alcohol addiction, which is a compulsive and uncontrolled consumption of alcoholic beverages, usually to detriment of the drinker's health, personal relationships, or social standing. For therapy uses, alcoholics had been given a nauseous-causing substance known as antabuse that reacts violently with alcohol when consumed by the client. They experience intense nausea and vomiting as a result. This sensation continues until the stomach is emptied, ridding of the alcohol along with the unpleasant chemical out of the individual's system. Antabuse isn't always proven to always work. It can still be a threatening chemical that can cause severe symptoms in the body. Aversive therapy can also be used to extinguish certain phobias or bad habits. Following the antabuse therapy, scientists concluded that the consequences doesn't necessarily have to be encountered with pain, having the patient physically and possibly emotionally suffer. A controlled comparison had been studied by Allen in 1966 for chronic nail biters that a bitter-tasting chemical revealed that a mild aversion therapy proved a more compelling improvement. A more effective form of aversive therapy was conducted by an experiment by Albert Bandura of the social learning theory, known as the Bobo Doll study. In this experiment, 66 nursery children had been put into 3 groups. In the first group, children saw the model attacking the doll, then being rewarded by the second adult. In the second group, the children saw a similar aggression, but only the second adult telling of the model for aggressive behavior. In the third group, the model neither punished the doll or was rewarded, which showed less aggressive children or having to never touch the Bobo doll.
That's all, folks.